Schizophrenia. Here is a brief introduction to schizophrenia. Schizophrenia is a serious mental illness that affects how a person thinks, feels, and behaves. They seem like they have lost touch with reality. They might interpret reality abnormally. Schizophrenia is a psychotic syndrome. Psychosis refers to the term losing touch with reality, seeing, hearing, and believing in things that actually does not exist. And syndrome refers to an illness in which different people experience different symptoms. People with schizophrenia might see, hear things that other people do not, believe in things that are not true, and might feel people are reading their minds, or they might feel that people are controlling their thought or inserting thoughts into their minds, or people are trying to harm them. An example is a person might feel and see a friend for years, but other people are not able to see that friend. Or a person might feel that they are God or a friend of God, which is also not true. They also experience lack of pleasure, trouble with speech, withdrawal, struggle with basics of life, and flat affect. Flat affect means that they show less emotion or no emotions at all. Her face was a solemn mask, and she could neither give nor receive affection. A mother talking about her daughter with schizophrenia. A person with schizophrenia is not able to manage their personal and social life, neither they are able to take care of themselves. After this, we will talk about symptoms. The symptoms of schizophrenia are divided into three parts: positive symptoms, negative symptoms, and cognitive symptoms. Positive symptoms does not mean that it is something positive for the person, rather, it means addition in abnormal behavior. It may include delusions or disorganized speech. It can be thinking to heightened perceptions, hallucinations, and inappropriate affect. Negative symptoms include pathological deficits or characteristics a person lacks in behavior, poverty of speech, blunted or flat affect, loss of volition or interest, or social withdrawal. Cognitive symptoms include poor memory, learning, and understanding. So, what symptoms are needed to be present for a diagnosis of schizophrenia to be made? The first one is delusions, the second one is hallucinations, the third one is disorganized speech or thinking, the fourth one is disorganized or catatonic behavior. This may include abnormal behavior. Fourth one is negative symptoms. These symptoms must be present for 6 months at least, and in one of those 6 months, the person must be experiencing active phase. One of the three symptoms, the first three symptoms, delusions, hallucinations, and disorganized speech, must be present with specific or significant distress and social or occupational dysfunction. Here we discuss the causes of schizophrenia. The exact cause of schizophrenia is unknown yet, but all the different models have given different reasons. Biological theories provide evidence based researches than other models. Twin studies suggest that there is genetic and environmental influence in schizophrenia. Adoption studies suggest that biological relatives are more likely to develop schizophrenia than adoptive relatives, which provide the evidence for the presence of genetic influence. Biochemical abnormality. Antipsychotic medicine lowers dopamine activity and reduces symptoms of schizophrenia. Thus, researchers believe that increased dopamine activity is also related to schizophrenia. Some other reasons or some other causes of schizophrenia are social labeling. After being labeled as schizophrenic, people are treated in disempowering and dehumanizing ways, which encourage the psychotic behavior more. This can also be studied in Rosenhan's study. Another reason is family dysfunction. Double bind communication. which means that in this communication, parents say something else and express something else. This makes the children suspicious and confused. And After that, family stress is also believed to be involved in the development and sustenance of symptoms. Such environments display more conflicts and poor communication between family members. Treatments of schizophrenia include medication. Antipsychotic drugs are used to reduce the symptoms of schizophrenia. Other than medication, psychotherapy is also used to treat schizophrenia. In psychotherapy, thought and perceptual disturbances are relieved through antipsychotic medicines. And then people with schizophrenia learn about their disorder, think more clearly about themselves and their relationships, make changes in their lives, and manage and cope their stressors. After that, CBT is also a treatment. Cognitive behavioral therapy is designed to change the ways people view and react to their hallucinations. In this way, fear and confusion caused by delusions can be eliminated. Recognize that this is illness just like diabetes. They are not to be blamed, and there is nothing they did to deserve this illness. Be kind and understanding.